So hello everyone, I'm Ramona Guargas. I'm the co-founder and editor of San Jose Spotlight, the city's nonprofit news organization. And thank you for joining us for our second exclusive Q&A with Santa Clara County Public Health Officer, Dr. Sara Cody. Dr. Cody, again, thank you so much for making the time today to speak to our readers and our viewers about COVID-19. You know, a lot has changed since the last time we sat down with you in April, 6 months ago. But we're still not out of the woods with COVID-19. So let's jump right into some questions directly from our readers about the coronavirus pandemic. The first one comes from Clara Kuhn, and she would like to know what the plan is to vaccinate everyone in Santa Clara County. What would that look like once the vaccine is ready?
I think it will be a stepwise process, and the reasons for that are many. First of all, we don't even know yet what vaccine or vaccines we might have available. The two vaccines that we know about now, for example, have different conditions under which they need to be kept. For example, one vaccine has to be kept at minus 70 degrees Fahrenheit, which, you know, most people don't have a freezer that's quite that cold. Another example is one vaccine needs 2 doses 21 days apart. The other needs 2 doses 28 days apart. And we know that once you start with one vaccine, you have to finish with that. So there's lots of logistical complexities and lots of unknowns. Just very broadly, what I can tell you, though, is that it's most likely that we would get very few doses by the end of the year, if any. And most of the vaccination would probably not start until spring or summer of 2020. So we're planning for something far in advance. The other important thing to know is that we, like everyone else, will be required to follow the guidelines, the national guidelines from ACIP, the American Academy of Immunization Practices. And so we're not going to have lots and lots and lots of leeway in how we do this.
Mm-hmm. That's helpful to know, Dr. Cody. You know, the next question is about sporting events, and I know that the county has pulled back some of the restrictions, and we're starting to, you know, reopen a lot of businesses. And Fernando Alvarez wants to know, how close are we to allowing a % of fans to gather at outdoor sporting events?
So an outdoor sporting event would be a very, very large gathering. And so I think we're a ways off from having something like that. We're really focused on what do we need to do now and in the next days and weeks to protect the population and to ensure that we get through the fall and the winter, and then we'll sort of see where we are. You rightly noted that the county is doing better, and we anticipate that we'll be in the state's orange tier probably as early as next week. And since we're aligning more with the state, that's going to mean a lot of loosening and a lot of opening. I want to be really clear with the audience that just because something is open and available doesn't mean it's safe. It doesn't mean it's safe. We still have quite a bit of this virus circulating in our community. We know how easily it spreads and how quickly we can get into trouble. It really is, the wildfire analogy is quite apt. So once you have a little ember that sparks a fire, it can get out of control very quickly and take a long time to bring back under control. So yes, we'll be easing. Yes, there'll be more activities and businesses available, but we're still in a very vulnerable situation, and we still have to all be extraordinarily careful to wear our face coverings, to keep our distance from people outside the household, and as much as possible to try to do activities outdoors or in a very well ventilated space.
And that's a perfect segue into our next question. You know, you've talked a lot about how it's much safer to be outdoors than it is indoors, but as people start gathering a little bit more indoors, how can they do that safely? This is a question from Mary Mabin. And kind of a two-part question, how would you provide good ventilation for indoor gatherings without opening windows?
Right. Well, a couple things. First to know is that we're developing some county guidance regarding ventilation, so that any business or activity that's being conducted indoors, there'll be some really practical guidelines for how to improve ventilation. So know that that's coming, and that's coming soon. The basic idea is that you want to assume that someone in the space might be infectious and might be producing those particles of varying sizes that contain the virus. And so what you want to do is dilute them. And you can either do that if the building has an HVAC system. So you want to make sure that you have a good filter in the HVAC system and a lot of air exchanges, so you're really refreshing the air. If you're in an indoor space that does not have an HVAC system, there are still things that you can do in order to improve the quality of the air and to dilute those little infectious particles. And so one would be to open doors and windows and get the outside air in. And you can move air with fans. So if you have a ceiling fan, you want to make sure that it draws air up. You want to make sure that you place fans so that they don't blow air onto people. But the general idea is that you would place them so that they draw the indoor air outside. And then the fresh outdoor air can come in. So you draw the stale, contaminated air outside. The other thing to keep in mind is filtration. And so even if you don't have a HVAC system with a filter that's filtering out those infectious particles, there are portable air filters, and some of them are rated. So you have to look at the rating, but if you pick an appropriate rating, you can also get some benefit by filtering the air. So remember, you want to dilute it by getting more outside air in, and you want to filter it by trying to remove whatever infectious particles. And then, very important, anytime you're indoors with anyone outside your family, you wear a face covering. So for example, right now I'm sitting in a room with somebody else outside my family. I am wearing a face covering for the interview for that reason, because I'm not by myself, and I don't want to put my colleague at risk.
Yeah, that makes sense.
Mm-hmm.
Thank you for clarifying that. And I want to go back to vaccines for a quick minute. Another question, we had a lot of questions about vaccines actually, and this
Mm-hmm.
one came from Michelle Liu, and she wanted to know, what your thoughts are on how access to a safe COVID-19 vaccine should be prioritized. Who's going to have access first, and also how do we encourage residents to get vaccinated, especially as there might be some trust issues? How do we get people convinced to get the vaccine?
Yes, I think that is a very important issue that you've raised around trust in the vaccine. So it is both access to the vaccine, and then if the vaccine is available, making sure that especially those who really need it get it. With regards to the first part, again, the vaccine will be distributed to us initially in very small amounts, and we will need to distribute it based on the priorities at the national and state level. So for example, that's likely the first priority would be healthcare workers who are taking care of patients with COVID. There's not going to be a lot of vaccine at the beginning. But then if you imagine we go to the scenario, however many months down the road where we have ample amount of vaccine, and our challenge is to get the population vaccinated, what's going to be really important for us to understand is how do our communities understand the vaccine and feel about the vaccine, and what are the barriers? Why are people hesitant? And so we're actually thinking about that already, as are many communities, and thinking about how do we do some more qualitative research to understand what the barriers might be, and start to work on that, because that's critically important. It's not just having a vaccine; it's ensuring that people can get it and will get it.
Yeah, the education portion, right?
Yes. Yes.
Yeah,
Yes.
And I know, one of probably the most difficult parts of your job is balancing all these varying needs and priorities. And so Sandra Delvin wants to know, how does the health department balance medical issues, such as the increased suicide rate, drug addiction, depression, delayed cancer treatments, increases in child abuse and domestic abuse, all these things that come with, sort of the sheltering in place. How do you balance that, when you're making COVID-19 decisions?
Yes, there's in public health, we do think about health very holistically, and there are so many various factors that impact our health and well-being. I want to clarify, though, a couple of surprising findings. The sort of implicit in your listener's question was that we have seen elevations in those conditions, and actually in many cases, surprisingly, we haven't. We do look at data across our county for non-COVID conditions to try to understand how the pandemic and the recession and everything else is going on is impacting health. And I actually just pulled some statistics because I thought your listeners might be interested to know. So we look at our emergency medical service data for who's transported for things like a mental health crisis or a drug overdose or trauma. And those services actually decreased in March and April, and then gradually came up, and now they're about where they were pre-shelter in place. Our suicide rates we've been looking at and following very carefully. And they're actually similar so far in 2020 to what they were in 2017 through 2019. So we have not seen an uptick in suicide. Our emergency department visits for everything related to anxiety, to mood, depressive orders, and suicide attempts, those decreased after shelter in place was in effect. A lot of just sort of general access decreased, and they're now back to pre-COVID levels, but they're not above pre-COVID levels. So that, I'm sure that's surprising, but that is what our data show. And I also just wanted to note that in our county and many counties, we never closed any healthcare operations. So hospitals and clinic and healthcare for whatever the healthcare need was available. And we did that, very, very intentionally. We didn't want people to not access care for whatever healthcare need they had. During the early days in March and April, we did see a decline in people accessing care, and I think it was because primarily driven by a fear of COVID. And so in a way, the better that we can control COVID and prevent its spread, the more people will access other types of care when they need it, and the safer and healthier they'll be. So I really think the actual key to all of this is getting the pandemic under control, and then everything else really follows. And so that has been our primary focus here in the county, is to protect our residents from hospitalization and death from COVID, and keep the general transmission levels just as low as we possibly can.
Yeah, that makes sense. Thank you for sharing that data too, because I'm sure it is surprising to some. And then the last question, if we could wrap up in a quick, minute here. I know you've got to get going. This comes from Kirk Vartan, and he wanted to know when our county will have rapid testing available for people who need to work, the frontline workers. So maybe 15-minute results, this kind of a quick result system. When do you think that might be available in our county?
We have a whole testing team led by our former health officer, Dr. Marty Fensterscheib. We are looking at lots of different antigen tests, which is those quick tests. None of them are perfect. All of them have some caveats. So we are, actively looking to try to find something that's reliable and accurate. None of them are as sensitive as the PCR tests. They're not going to capture everybody, but if you get tested frequently, that kind of balances out. But for now, we're still really leaning in as a county to providing access to testing that's free and available, and our turnaround times have decreased quite a lot. Now, about 24 to 48 hours. So drive through at the fairgrounds, pop-up sites in every city, and more pop-up sites in communities that have been most impacted by COVID. So we encourage everyone to go. And under my health officer order, all healthcare facilities are required to offer tests to many different groups. And so everyone should be able to go to their healthcare provider as well. So thank you so much. It's a pleasure to be with you.
Thank you so much. That was a really important reminder and a lot of great information, Dr. Cody. Thank you so much. And that's all the time we have for now.
Okay.
We know how busy you are, so thanks again for making the time.
Thank you so much. All right, bye-bye.
Absolutely, bye-bye. And thank you everybody for tuning in. I just wanted to mention, if we did not get to your question today, Dr. Cody and her team have graciously agreed to answer your questions after, and we'll post them on our website soon. And we'll also have the video from today's forum, as well as a recap story if you missed the beginning or you want to just catch up on what you missed. So thank you so much for watching, and please visit sanjosespotlight.com and have a great day. Thanks, everybody.